Hi everyone. This is Dr. Mahajan from Golden Glow Medical Spa. Welcome everyone. Emily's already tuned in. Hi, Emily. So, I'm waiting everyone to tune in for our event. So, that's a fun event today for Galentine event. We are going to do some special things today. We are going to do a live injection in which we're going to go over the consultation part to do a dermal filler. The dermal filler is what we do, why we're doing it, which area we choose, and we're also going to show that. The amount of the filler, which filler we are choosing. And if you have any question, please share in your comment, and we will going to be addressing that. So again, thank you for joining us today, and a lot of other people are joining today as well. So Denise here with me today. She is going to go over all the agenda in the detail, and we are going to go over our event pricing and the raffle information. We can do live consultation, and we are going to go over the special pricing, as I said. And you can always can ask our question and answer here. And if you want some more information, you can always book a consultation with me. All right, so I will hand over this to Denise, and I'll go and we go with Tina, which she's a lovely girl, which we are doing some injection today, and I'm going to go in detail about the little consultation before the injection, and we'll go take it from there.
We're just getting a couple more minutes to get the camera all set up here. Dr. Mira is getting ready to do a consultation on one of the girls, Tina, a familiar face here at Golden Glow. She's actually going to be doing a cheek filler, so you guys will get to see that. Lots of exciting things are happening tonight. So I do want to go over the specials and the raffle that are going on for tonight. And thank you again for joining us. Please be sure that if you are tuning in, please go ahead and comment your name, because part of the event specials tonight is that if you did tune in, we will be adding $50 onto your account here. So please be sure to comment your name so we know whose account to add that. And if you did refer a friend who is also watching tonight, please also let us know about that, because for every friend you did refer that is also tuning in, they will also get $50, and so will you. So please be sure to comment your name down below. So I'm going to go ahead and go over the raffle. So the grand prize for tonight is worth $2,800. It is going to be 5 ml Latisse kit. So that's going to be like a 3-month supply, 40 units of Dysport, a Thermiva vaginal rejuvenation treatment, full-size Elta MD products. We're also going to be giving away in that package 1 lip injection, a Belgium chocolate hydro jelly mask, a skincare gift bag, and actually the skincare gift bag is from SkinCeuticals products. Also, if you do stay tuned through the entire event until 7, we're going to be giving away 20 units of Dysport to 3 lucky winners. In order to get into that drawing, you will need to like this post, this feed that you're watching, share it, and please be sure to make it a public post so that we can see who's sharing it. So if you're watching through Facebook, please make sure when you share it, it is public, and go ahead and comment that you shared it. You will be entered into a drawing that I'll be picking 3 names at 7 o'clock tonight, where you'll get to win 20 units of Dysport. So that was the grand prize raffle. We went over the 3 chances to win. I'm going to go ahead and switch the camera over to Dr. Mir so she and Tina can go ahead and greet you guys.
All right. Hi, everyone. So I'm here. As I said before, we're going to do our live injection demo with our lovely Tina here. A lot of people know Tina. Say hi to everyone.
Hello.
So Tina, let's get close to her wonderful face. So Tina is like pretty, but looking at Tina's face. So Tina, tell our viewers or to me, like why we're doing this and what you're trying to achieve. Look in the mirror and.
I want to get rid of some of the hollowness at the top of my cheekbone.
So what Tina is showing us, and some people experience that we have some volume loss which can happen in our face, and we have pockets of fat, which is in the temple in this area, and in the cheek area, and like around in front of our ear, and certain areas. And when we age, and I'm not talking about Tina, she looks wonderful for her age. These fat pads kind of a decrease in volume and they shift. So giving some volume in her cheek, we want to definitely rejuvenate her eye too, and give more volume in her face and give more almost like a lift to her face. So that's what we're trying to do today. All right, so now as we see what we're trying to do, we come to the point like how much filler we need. Like everybody is different. And one syringe of filler is only 1 ml, and 1 ml is not a big amount of filler. So we can always see a difference, but we can always go and add on. So guys, today we are using Voluma, Juvederm Voluma. Voluma is a Allergan product. It's used for cheeks and jaw sculpting, and then FDA approved recently for chin augmentation. So chin gives beautiful, excellent result, but today we are using for the cheek filler. Okay, so let's get going. I want you to rest your face in a comfortable position. And we're gonna clean her face with this little alcohol.
Now, Dr. Mira, is this going to be a specific technique you're doing, or is she gonna have like several needle pokes? Like, how are you going about this?
So Denise is asking about this technique. So generally when I'm working in the upper face, I use this technique a lot. This is called a micro cannula technique, in which instead of using a needle, I use a cannula. So cannula has a blunt tip, and the product coming from the side of the tip, and it's very flexible. I don't know if you can see that or not. It looks like a needle, but it's actually not. So instead of cutting through the tissue, it goes around the tissue. So if any blood vessel, any muscle, tendons, or important structure comes in the way, it just goes around it, not cutting through it. So any trauma, swelling, bruising is way less through that. So needle, I'm just making an entry point, because cannula, as I said, cannot do that, cannot do the cutting part. So that's just the entry point, and through the entry point, I'm going to thread my cannula through that. So I just need to see that, and kind of going through that. And now I'm going to deposit my product kind of slowly where I need to be. And Tina is going to feel a little pressure in that area. So you can ask the question, Denise, because sometimes when I am injecting, I go really, really silent. So if the Tina, any of the Amanda can crack any jokes, want to tell any stories, please free to do that.
Tina, how are you feeling? What does it feel like?
I really don't feel much of anything. What I feel is a little sting from the lidocaine in the filler.
Yeah. So that's what it's kind of makes this technique pretty like nice, and looks easy and makes it comfortable. So if you can see, I've just done with less than half of the syringe. So you can see the difference between Tina's upper part of the cheek, and you can see the difference in how so the eyes look more rested. So Tina, if you can look in the mirror and see, can you appreciate the difference between the eyes on the both sides a little bit?
Yes, I can definitely see a difference. It looks a lot better.
Right. So that's what kind of we are hoping. And this is just like you do a little bit and see, and then go back and kind of trying to do that again. So I want you to.
So Dr. Merritt, we did have somebody ask, Ashley asked, so what is this? Oh, she can't hear me.
Yeah.
You can still hear me. So what is it that you're doing? So if somebody has like tired eyes, would this be a procedure for them, or is there something else you would recommend? Is it just for somebody who wants fuller cheeks?
So the tired eyes can mean a lot of things. Tired eyes means volume loss around the eyes, or the volume loss in the upper cheek. Tired eyes can be pigmentation around the eyes. Some people have like a lot of vein issue, pigmentation issue. So this I'm doing, it's more the volume loss issue in the upper cheek. But if somebody has like volume loss in the middle of the eye, so the good answer to that is to like looking at somebody and doing a consultation will be the ideal thing to do.
Tina, we had a patient say that you look beautiful.
Oh, thank you. You guys are kind. All right, we are getting there. I don't know if people can see or not, but I do appreciate your input.
I'm going to go ahead and put up the specials just so everyone knows. We do have our Juvederm and Restylane fillers. They're going to be buy one syringe, get one syringe 50% off, or buy two syringes, get one free. So, Dr. Mira, for Tina, you're using one or two syringes?
Today I'm going to use two syringes, okay. One in each cheek.
Okay.
Definitely.
So somebody who's wanting maybe like their cheeks done and maybe their lips done, the buy two get one free special would be a great package for you.
Yeah, I mean that's what like we think when we thought that special, because even if the youngest person who is in their 30s or 40s to give the augmentation to the cheek and one in the lip, or if they want like one and one in nasolabial folds, so you can use that easily wherever is like somebody requires to do.
Okay. And then another special we have for those of you that just want to stick with one syringe, maybe you just want to do your lips before Valentine's Day. We have a special for you where you can save $100 off any Restylane or Juvederm syringe. And then as far as the neuromodulators go, Botox and Dysport are going to be on special. So if you are a VIP member, you'll actually get your Botox or Dysport at $8 a unit when you purchase a minimum of 30 units or more. And then if you're not a VIP member, we still have a special for you. You can get it at $9 a unit if you purchase a minimum of 30 units.
Yeah, you should become a VIP member.
So go ahead and put those up so you guys can see them. So all the fillers are going to be on special. We also have Sculptra on special. You can take advantage of Sculptra if you're somebody who's been waiting around for that special. You could do buy two Sculptra vials and you'll get one free. We will also have Kybella. Kybella is going to be on special where you could buy 3 vials and get one free. So if you've been wanting a more defined jawline, or maybe you wanted to target some jowling that you've been seeing, you would be a candidate for Kybella as well.
So talking about volume, like if we put more volume, Denise, I don't know if you can show me. So you can see the difference between like one side of her cheek right here, and then if you look in the mirror, like right here, as compared to this side right here. So what we do with Kybella, like we want to put the volume here, and we want to take away the volume here. So we are doing that's what we want to do. How we age, we want to reverse the triangle of aging. Like you want the volume like this. So less volume in here in the lower face, more volume in the upper face. So with the Kybella, we take the volume away from the neck and the jaw. So that's what the Kybella does. And the fillers, we want to put more volume in the cheeks and the temples and the upper face. So when we age, because the triangle like reverses, we have less volume on the upper face and gets more volume in the lower face. We don't want that, right?
No.
No.
No, we don't.
And just so everyone knows, the specials will be available from 1 week from today. So you can take advantage from today on to the 18th. So next Thursday, we'll go ahead and notify the winner of the grand prize at that point. You can certainly call to take advantage if you know your wish list right now, or if you want to tell your significant other, hey, this is what I want for Valentine's Day. Let's take care of this now. We do have the girls at the front available to go ahead and take those calls and handle that for you. And you're more than welcome to stop in or call and schedule an appointment. The consultations are complimentary, so we could figure out what the best option would be for you. Dr. Mir, we did have a question. Beverly is asking, what is Sculptra?
So Sculptra is a special type of filler. We call it biostimulant that stimulates your own collagen. So it is just like scaffolding for your own collagen. This is it's a kind of a filler which we put in these areas, like right here, for the people who has lost a lot of volume in their face, and we inject the Sculptra. Sculptra goes away in a couple of weeks, and it leaves you with your own collagen production. And you may need more than one session of the Sculptra. So that is Sculptra is different than like Juvederm. I'm putting Juvederm, and that's what you're going to get, and then your body absorbs it over the time. So that's how it is different.
So, Dr. Mira, how long would you say this treatment for Tina would last?
Okay. I'm sorry, say it again.
How long would you say this treatment for Tina would last for?
It can last up to 1.5 to 2 years. That's the duration of the Juvederm Voluma is, but everybody is different. So in some people, they absorb filler more than other. So average duration is 1 to 2 years. So completely it will be gone in 2 years, but maybe some people will need another touch-up after a year.
And so Tina can't get out of working tomorrow, can she?
Yeah, we do that, and we kind of work. So you will be seeing us and her tomorrow. So who want to see how she looks tomorrow, you can definitely let us know. Her cheeks are looking pretty good.
Looks great.
Can you guys still hear me?
Yeah, Denise, we can hear you.
Okay. We have another question. Marie is asking if you can use Sculptra anywhere on the face.
Sculptra can be used most of the areas like cheeks, nasolabial folds, lower face. You will not use Sculptra in the lips. Most of the time, you will not use Sculptra like near the eyes, like in tear troughs. So most of the areas, yes. So yeah.
So Tina, have you ever had cheek filler before?
I did cheek filler a couple of years ago.
Okay.
I think she had
Yeah,
Belafil.
I have Belafil, but I think it was more in the apple of my cheek.
So she had a inner cheek done, which still looks good. She had Belafil done. Belafil is a 5-year filler, and that area still looks really good. We are working on the outer area of the cheek this time, which I'm just finishing up on the other side of the cheek now, which looks really good. And Tina's doing really great now. I'm just have to thread my cannula because
No, you're looking like you're relaxing over here. This is a relaxing experience.
I mean
It's not bad at all.
it's kind of a look like I'm shoving things around in her face, but it's actually not painful. Not as lips as compared to lips is more sensitive.
So if somebody had a wedding to go to, how soon in advance should they do this procedure?
I will need at least like a week or 2 weeks maybe to do this procedure. Yeah, so because next day you can have swelling still because you're still putting filler in your body and your body can react with the swelling. So swelling start in next 5 minutes or so, the first 24 hours when you're going to have most of your swelling, and then you want to ice the area. The swelling then kind of start coming down each day. It looks better and better. And everybody is different. Like some people don't swell at all, and some people are swellers. Like they do swell more than others, so it's hard to predict. So I will just say, give it like at least 2 weeks if you have to go to a big party, big event for that particular reason. So we are almost done with Tina's cheek here. And we focus to kind of lift the cheek, so eyes looks more rested, so fill it around the eyes, so it's upper cheek, outer cheek area. And as we said, 1 ml is a kind of a minimum amount. We're just kind of smoothing the product here. Looks really natural. Doesn't have much swelling and bruising yet. So you can have some picture, and Tina's all yours. The floor is all yours.
So Tina, would you do this again?
Definitely would do it again.
Look in the mirror and see what you see.
Oh, that looks a lot better. Thank you. That looks really good. Look, guys.
That's great.
What do you think?
That's really nice.
Wow.
Yeah, you guys, can you see like now this area, the eyes, kind of the cheeks?
Looks great. Mm-hmm. Beautiful.
Well, this is online time, guys. That's all you're going to get.
We do have another, looks like sculpture is a popular topic tonight. Somebody is asking, Evelyn is asking, how long does sculpture last?
Well, same like Juvidum, the sculpture lasts up to 2 years. And again, it's depending upon person to person, because sculpture is a biostimulant. It stimulates your own collagen. So some people generate more collagen than other. And like every 8 weeks, you can inject according to, you can inject more. So say you have 2 vials in the cheek in this area, and you see they're filling up, and then you can inject more. And then first you are done and you are happy with your results, then it's just maintenance, like 1 to 2 vials once a year. So Sculptra is a great product. You need maintenance to get it injected, but it stimulates your own collagen. It's good. It's natural looking. Juvidum product is somebody who doesn't have patience like me. You get inject, you get what you want. You know what you're getting. It's you're going to stay for that long. And yeah, that's it. So
we have another question here from Barbara. She's asking, is there a lot of bruising with this procedure?
So that's, here is Tina. Do you see any bruising right now?
Not much bruising. Last time I got my cheeks undone, I didn't have any bruising. Yes, it felt sore underneath, like it was, I had, some bruising underneath, but to see a bruise, you didn't see a bruise.
So yes, you're going to have some swelling for sure. Any filler you're putting, you don't have going to have some swelling. Your body is going to react to fill. If you press it, you're going to have some soreness for sure. With the technique of the cannula in the cheek, you are going to have minimum bruising. Tina right now does not have any bruise at all, as you can see. If you go close to her, you can see on like really close on the both side. But it doesn't mean that you guys can't. Like you can still have some bruising, but with this technique, your bruising is way less than the needle.
Okay.
In certain areas, sometimes you have to use the needle to give the best result. But in the cheeks, in the lips, we use this technique a lot, and around the eyes.
Okay. Tina, we have a comment from Trish. She says, Tina, Hollywood, here you come.
Thanks, Trish. I don't think I'm there yet.
Almost there, almost.
A lot of everyone is commenting that they can see a difference. It looks amazing. It looks great. You look great, Tina. Tina's
Thank
getting
you.
a lot of
Tina,
love
give
tonight.
me a flying kiss. Flying kisses from Tina. Can you give her a flying kiss?
Come on, kiss your fans, Tina. Now, is this treatment something you can combine with other services you offer here? Like, I know a lot of us like getting hydrofacials or IPL. Is that something we can do all in one day?
Yes. So this is we're giving the volume. We're going sometime underneath the skin. So when we're doing IPL or BBL, we're taking care of the skin, the sun damage. We're giving collagen production. We're taking of redness. So we combine the treatment with that, and the Botox or Dysport. We are taking care of the lines and wrinkles, which is caused by muscle movement. So we're relaxing the muscle. So these three treatments are combined all the time, very popular in our practice. So you numb the face, you do the filler, you do the IPL, and you do the Botox in that order. The other popular service in our area is to doing the threads or to decrease the laxity in the lower face. That's another area people kind of combine a lot. But that makes sense because there's a couple of things like how we age, like lines and wrinkles due to the muscle movement, the volume loss, something happening on the skin, and the laxity of the lower face. So BBL, fillers, the Botox, and the threads. And when you have the downtime, you want to do a couple of things together and have a downtime at the same time and look wonderful for Valentine's Day, or for your wedding. You just want to look, beautiful and do 2-3 things at the same time. Like non-surgical things is the same thing with the surgical things. When you go into a surgical procedure, they do like resurfacing or neck or eyes, a couple of 3-4 things together, so that when you are having a downtime, you're recovering at the same time with all 2-3 things.
Awesome. A lot of people are saying you look amazing. What a great difference.
Thank you.
That's I love you all. Thank you so much for being here.
A couple of you are asking if we can have the specials emailed. I can certainly send those out. Please be sure that you subscribe to get our emails. A couple of you don't get them, and mainly it's just that we need to have you subscribe to receive them. But I can certainly send those out. They're going to be available until the 18th. So next Thursday, you'll have an opportunity to get into that big raffle. Every $500 you spend will get you one raffle ticket. And then if you are a VIP member, you'll actually get double the amount of raffle tickets.
That's okay.
And again, Dr. Mira is going to be giving away a 5 ml Latisse, so that's a 3-month supply. She's also going to be giving away 40 units of Dysport, a Thermiva vaginal rejuvenation treatment. So actually, Dr. Mira, can you talk a little bit about Thermiva?
So Thermiva is a non-invasive, a good treatment for vaginal rejuvenation. So a lot of times, like it was a taboo to talk about female feminine health. Like nobody want to talk about it. But we all know, like after childbirth, the vaginal laxity is an issue. A lot of women suffer from that. The bladder incontinence, like urinary incontinence, the dryness, the painful intercourse. There's a lot of areas we don't want to address. And the Thermiva address all those issues. And it is just not a vanity issue. So this is a gentle heating treatment which uses radio frequency. It's a gentle probe, takes 35 to 40 minutes to do in the office, doesn't have any downtime. So as I said before, it kind of addresses the vaginal laxity, dryness, urinary incontinence. So all these issues are addressed, which a lot of us do kind of suffer from those areas. I see a lot of ladies ask about this treatment, and a lot of OBGYN kind of recommend. Now, when you're taking like hormones, there's a lot of systemic side effects. With this, there's no systemic side effect because you're not taking any pill or you're not using any medicine. So it is a treatment we are just doing outside. So that's pretty much in the Thermiva treatment. If somebody has interest in it, I'll be more than happy to just talk one-on-one about it.
Great. So Trish wanted to share, Dr. Mira, you are an artist.
Thank you, Trish. I do appreciate that. I do try my best because I feel like we deserve to look our best. And every face is unique. We are not perfect, and that makes us unique. And we deserve to look what we want to be.
And Charlotte wanted to share, Dr. Mira, you are the bomb. You are the only one I trust.
Thank you so much, Arlene. I do appreciate that trust, and I'll keep working my heart to keep that. Keep improving myself. Keep putting in my high standards. Thank you so much.
Okay, so again, the grand prize is going to be valued at $2,800. It's the 5 ml Latisse, 40 units of Dysport, 1 Thermiva vaginal rejuvenation treatment, full-size products from the Elta MD skincare line. I know a lot of you do love their sunscreen from there. 1 lip injection, a Belgium chocolate hydro jelly mask, a skincare bag featuring products from SkinCeuticals, another popular at the spa. So you will be able to take advantage of that until the 18th. Every $500 you spend will get you 1 raffle ticket. If you are a VIP member, you will get double the amount of raffle tickets. So I do encourage you to take advantage of that. I'm also still getting some names of the other raffle we're doing tonight, where you'll have 3 chances to win Dysport tonight, as long as you like this post, share it, and when you do share it, make sure it's public so we can see it, and comment that you shared. You'll get entered. I'll pick 3 names tonight at 7 to win 20 units of Dysport tonight. I'm going to go ahead and put the specials up for you guys again to see. Lots of specials going on. So Botox and Dysport are on special for VIP and non-VIP. $9 with a 30 unit minimum purchase if you're not VIP. And then if you are a VIP member, $8 per unit, minimum 30 unit purchase there. We do also have the 5 ml Latisse kits. You can take advantage of $50 off there. If you are a VIP member, that brings it down to $113.62. And if you're not a VIP member, it would be $142.50, and that's a 3-month supply of Latisse. And that is going to be while supplies last. The other specials, all the Restylane and Juvederm fillers, they're going to be buy one, get one 50% off, and then buy two, get one free. We will also have Sculptra on buy two, get one free Sculptra vials. And then if you just wanted to take advantage of one syringe, maybe to do your lips, you can save $100 off there on any Restylane or Juvederm lip filler. Okay, Bella is also going to be on special tonight. You can purchase 3 vials and get one free. So definitely take advantage of that if you want a more defined jawline. And then here's the raffle again, just so you guys can see everything that's going to be in there. One lucky winner will win from that raffle on the 18th. Let's see what other questions we have here. Hi, Debbie. Hi, Margie. Or you want me to? Does anybody have any questions for Dr. Mira tonight? Please be sure to comment. She's definitely here to answer all of your questions. Does anybody have any feedback as far as what our next event should be? So Margie, to answer your question, do you have to order the Botox tonight? It is going to be while supplies last. We have a limited amount we can sell at the $8 per unit and $9 per unit. That will be available until the 18th. So I do encourage you to call when you can, just to lock you in at that if you wanted to take advantage of those savings. You can call, you can schedule a complimentary consultation. We do have some availability from here until then. The girls can also look at what your amounts were that you had the last couple times to quote you on what amount you should get this time. So lots of options available for you. I do encourage you to call if you know you want to go ahead and take advantage of that. We can also use your Alley points. So Brilliant Distinctions did rebrand to Alley. So if you have points in there, those can also be applied in conjunction. And then for Dysport or Restylane or Sculptra, you are more than welcome to use your Aspire points if you have any points available through there. So Dr. Mira is currently getting re-mic'd up. So I'm going to have her answer some of these questions that are coming in. Dr. Mira, can you hear me? I cannot hear you, Dr. Mira.
Can you?
Yes.
Can you hear me now?
Yes. So we have a couple of questions that came in. Trish was asking, what is the difference between Juvederm and Dysport?
So Dysport is a product to relax our muscles, which is injected like in between the eyebrows or the forehead or around the eyes. These are the main areas. Of course, we inject around the mouth too nowadays. This job is to relax the muscles, which is causing wrinkles. So like we doing the frowning or lifting our eyebrows, so lines there. And the Juvederm is hyaluronic acid. It's a gel, it's a filler. So we are putting inside the skin to fill some lines. Totally different products, doing totally different job. So filler I was talking about before is giving volume. So sometimes we're using filler to give volume and to replace that volume loss, or we are sometimes filling just the lines around the mouth, the fine lines around the different area of the face. So they are totally different categories. The Dysport is a competition of Botox, and there are two more in the market, Xeomin and Jeuveau. They do the same thing. So their job is to relax those wrinkles, not fill them. So I sometimes I get these questions like I have lines in between my eyebrows, and if they're deep at rest, we can relax as much as possible the muscle, but sometimes they still, you can see them, they may not go away completely because Botox, Dysport, Xeomin, and Jeuveau, they relax the muscles. They don't fill the lines.
Awesome. We have another question here from Lisa. How do you decide which is the best filler for the cheek area?
There's a couple of filler which are there for the cheek area. Juvederm Voluma, which we use today, is one of them. The Radius is another one of them. The Radius is calcium-based filler, which gives good lift and volume. And Juvederm Voluma is hyaluronic acid, but it's more thicker than rest of the Juvederm family, which gives more lift in the volume. So how I pick and choose is they're each other's competition. They're different companies. So it is good to have the competition so that the consumer gets the best pricing and more options. And sometimes they come and ask me like, hey, I have a Radius injected before and I like that product and I want that product. Sometimes the company runs the specials and then they give to the consumers, to us too. So I like the both products and they have the different qualities, but sometimes Radius has a little bit more swelling and the feeling is a little bit more hard than the Juvederm. So the Juvederm and the Radius, they have their own fans, and some people want longevity. Some people want the filler which lasts 5 years or more, like men. They don't want to get injected like every 9 months to a year or 2 years. So that's a filler for them. That's how I pick my filler.
Very good. We have another question here about Kybella.
Yes.
Nita is asking, how effective is Kybella? How long does it take for full effect, and how long does it last for?
So Kybella is definitely effective, but Kybella is a dose dependence effect. So I can show you my before and after. I have used it. I know it works. But as I said, how much you put and then how much the result you're going to see. The Kybella product, when you inject, binds with your fat cells, and then your body is going to remove it slowly. So it does test your patience. So you are going to get the injection in the, like today, you're going to have swelling and bruising, which takes around 2 weeks, and then you'll see the results after 3 months. So it does test your patience. And if you have more skin and volume, you may need more treatment. So that's the thing about Kybella. But if you have only like a little amount, and you may not see the result you want to see.
Very good. Janelle had a question. Can you bank the Botox? You can certainly bank the Botox. Once it's on your account, it doesn't expire. So if you want to take advantage of that, definitely give the girls a call. They can take care of that over the phone for you.
You can bank any service with us. We have service people like having ears and ears, which they can come and do the service. Definitely can bank their Botox or Juvederm, their filler, even their lasers. You can use them anytime you want. Or sometimes they move to the area and they want to give it to their loved ones as a gift.
Does anybody have any other questions out there for Dr. Mira? Ooh, a lot of people watching tonight.
That is great. I'm so excited and I'm so thankful for everybody's time and tuning us with today. We have a lot of wonderful people over the years and time after time, and especially during this last 6 months to a year was especially crazy. But everybody did great. So thankful for the people who are working with us, with our staff, wonderful family here, and our people are just great. They're like our family. We've known them for years, and the new additions are keep coming. I appreciate your reviews. I appreciate your encouragement, good or bad. It teaches us a lot. That definitely, it's if you do a good job, we want to know. It gives a pat on our back. If we are doing bad, then we need to know. So we always, of course, we have to improve. So we do appreciate. So keep reviewing us, and of course the social media. We try to kind of put our work there, and follow us there. Tell your friends and family. So we keep doing our things there because everything is moving online. So we still try to connect to you guys so that we stay family as a whole, make sure everybody's doing good. We stay connected. We still have to keep up with ourselves, with our health, with our face, stay pretty.
We have another great question here from Trish. She's asking, will cool sculpting help under the chin after Kybella?
It depends. If it is, the cool sculpting works on fat. If you have excess fats, then yes. If you just have a skin laxity, then no, that's not going to work. So it's but if you have a lot of excess fat, then yes. And the cool sculpting also works in a couple of sessions. Each time it's working, like it's taking around 25% of the fat. Because it freezes fat only, it does not freeze the excess skin, excess tendon, muscles, or anything else there. So with Kybella, we do see some tightening with the other muscle or tissue too, but we have to understand that how the cool sculpting works. We have other, treatments for skin laxity, but cool sculpting is not for skin laxity.
Very good. Kim wanted to share, thank you and your staff are fabulous.
Thank you so much, Kim. We do appreciate that, and we appreciate you encouraging us.
These are very good questions. Does anybody else have any questions out there that they want to get off their mind? Maybe they're hesitant to do a consultation. We also do offer virtual consultations for those of you who don't want to do the in-person ones yet. We have another question here from Michelle. How soon do you see results after Botox?
So the Botox start working after 2-3 days. Everybody's different. The full result you see after 2 weeks. So whoever is generally doing Botox, we want to do a follow-up after 2 weeks to make sure everything is looking good, everything is doing what it's supposed to do. If certain area needs to be touched up or tweaks, that's the time to do that. So there's other products sometime Duo or Dysport does work a little bit quicker, but that's the timeline for the Botox.
Are there any other areas you can get Botox in that aren't like the usual, like the upper face, like maybe like for somebody who has like problems with teeth grinding or anything
Yes.
like that?
So Botox has a lot of applications in the cosmetic industry. They keep coming up more and more. When first Botox came, the FDA was only approved for here. Then they added FDA application for forehead, crow's feet. Now masseter is another one. Masseter is a big muscle which we use to grind the food, but overactive masseter causes the TMJ, which is the pain in the joint and the grinding of the teeth. So relaxing the lower belly of this muscle kind of relaxes solves the problem of the grinding of the teeth and the pain in that TMJ, the joint here. That's one. It's used around the lips a lot, called lip flip. It's in the upper lip injection to relax those lines in the lower lip. The angle of the mouth, DAO, so depressed angulus oris, to kind of lift the angle a little bit. In the chin, some people have like really puckered, strong chin to relax that. And the necklace lines, I have necklace lines, like I need some there. So platysma bands. Sorry guys, I can't be serious at that long.
Yeah, going back to the lip flip, that seems to be something popular nowadays. Even the younger crowd is doing that.
Yeah, lip flip is like all of a sudden I'm like everybody's asking for lip flip. So lip flip is just relaxing this muscle tiny bit. We inject like 2 to 4 units here, and it kind of everts lip tiny bit more. Very subtle, very natural, very popular in like young girls nowadays. So who doesn't want to do like filler or kind of like looking into it, they want to do lip flip. That's what it's called.
Yeah, what I noticed with Tiffany is she's hesitant to get lip filler, but she did the lip flip and it almost looks like it gave her like a nice.
Yeah, it looks like she has a little bit filler in her lip. So she's hooked to lip flip.
We have another question here from Donna. What is the cost around the jawbone on one side of the face?
You say what is the cost of the
Donna, do you mean like how many units to treat the jawline for Botox, or did you mean filler? I'll let her comment on there just so we can clarify. Jennifer is asking, how do you decide between a filler for your lips or augmentation?
Okay, so lip filler has a lot of options there. So Juvederm Maxi is the oldest one if you want like more plumpness in your lips. And there's a Restylane Kiss, there's another good product for the lip. And then there's a Volbella, which you want more, it's more thinner and finer if you want more natural look, as Juvederm Volbella. So how we go is just the feel of the filler. We have like a little tray, you're gonna feel it, like which one you feel like nicer and better than. If you want a little bit longer result, then Velour is Juvederm. There's all Juvederm family so far, like Juvederm Velour, Juvederm Volbella, Juvederm Maxi. And the cost also comes into the play. Some fillers are on special, some fillers cost more. And Restylane Kiss is also made for lips because its feel, its duration, and how it plumps, it's kind of better than other filler. So that's how we decide. We discuss like, hey, which you want the duration, the plumpness, more natural look. Are you going to work on the fine lines? And also like, you're going to go with what fillers on spatial. So these are the different factors how we discuss with you during consultation and choose which type of filler we're going to use.
We have okay, so Donna did clarify her question. So she has bad pain on the left side of her jaw. So I guess she's asking like what would be like an average range of units if she wanted to treat her masseter.
So it takes around 10 to 15 units per side to and I'm talking about Botox units to kind of relax the masseter muscle, and generally effect lasts up to 3 months, but it's injected like twice a year.
Okay. And are there any other areas for Botox? I remember, I think I saw you treat someone for sweating.
Yes, so underarms is the one area, and palms. And we have sweaty palms, so that's another area to treat. The area we inject here, of course, there's like a lot of application for Botox, like migraine and headache, and we don't do that here.
Very good. Looks like Beverly is asking, what is lip flip?
Lip flip is like injecting a little bit Botox in your upper lip. So when you do like 1 unit couple of units here, 2 to 4, 2 to here. So when this muscle is relaxed, this lip goes up a little bit. That's called lip flip.
Yes, I think what's funny is when Tiffany gets that treatment done, her boyfriend kind of asked if she got her lips done just because it has such an
Yes.
effect on her.
So it looks like you have your lip injected because you see more of the red lip. So this is called white lip and this is red lip. So you can see more red lip when its lip is flipped. It's a lip flip. I love those terms.
Brandy is asking, what is the most popular service besides hydrofacial?
The most popular service is Botox. So Botox and the fillers are the most popular service.
I have another good question here. Diane is asking, on average, how many units of Botox are needed for the forehead?
Okay, so as general, everybody's different, but it takes 20 units per area. So area I'm talking about in between the eyebrows, forehead, both sides of crow's feet. But when you're injecting like in between the brows and forehead together, then we cut down the unit. So it's going to be 20 and 10 maybe. And if you have only like your muscle is not as strong, so it can be just 10 units. So I'll say average is 10 to 20 units.
We have another great question here from Tiffany. What is the difference between Dysport and Botox?
So Dysport and Botox does the same thing. They relaxes the muscle, which causes the wrinkles. We call it dynamic wrinkles because they're caused by the moving the muscle right here. The frowning, the raising the eyebrows, the crow's feet, they are each other's competition, like Coke and Pepsi from two different companies. They compete with each other. There's a little bit minor difference in their molecular structure. They're both botulinum toxin. So, but the Botox comes in 100 units vial versus Dysport come in 300 units vial. So where we injecting 1 unit of Botox, we're injecting 3 units of Dysport.
We have another question here. So Karen, for a VIP member, do we just call the office for Dysport price that is scrolling? Yes, Karen, you can certainly call the office. If you're not available to jump on a phone call, you can jump on our website, and we do have a live chat feature. You can certainly purchase through there. You can email us or you can stop in. Whatever is going to be easiest for you, we can certainly take care of that for you. Any other questions out there before we wrap it up? I'm going to be drawing 3 names shortly to win 20 units of Dysport. Thank you for everyone who liked and shared this feed. Dr. Merritt is actively working on growing her social media following. So if you can certainly help us by liking our Instagram posts, following us, commenting, sharing our posts. And if you save our posts to your collection, that also helps us as well.
Yes, so I don't know, it was my cue to talk. Sometimes I'm kind of old, don't know the technology, but
no, we have another question from Evelyn. Okay. What would you use to plump the lower lip? Is there something like the lip flip for the lower lip?
Yeah, lower lip is just the filler. For right now, we do inject a little bit of Botox in the lower lip too, but it doesn't give that much of the effect. Because if we kind of do the lot of Botox on the upper lip and lower lip both, then we will not going to able to talk or eat or sip from the straw because we need that muscle. We can't weaken that muscle too much. Because you have to remember what Botox is doing, it's relaxing those muscles. That's how it works. So either we can relax your lower lip or upper lip, we can't relax them both.
I wish I could like Botox myself to stop eating so I would lose weight.
I know. So we can't. Who needs to eat or talk? We have so we have a limit on the we can only do the partial relaxation. So then if we have to do the lower lip, I will have to choose the filler.
All right, so I'm going to go ahead and pick 3 names now that we're approaching 7 o'clock.
Yeah, so Denise said, I'm trying to go on social media So please like and share, and like me on Instagram. You will be seeing me my funny posts and videos, like I'm jumping and doing around some crazy things.
It definitely encourages Dr. Mira's creativity.
Yes, but thank you so much again for joining us today and giving us your time and attention. I appreciate it.
All right,
Thank
I'm
you
going to
again.
go ahead and pick 3 names. Don't get mad at me if you didn't win. There will be other chances to win next month.
So,
First one is Michelle Adkins.
wow, Michelle. Yay.
Won 20 units of Disport. Picking winner number 2. Kim Armbrust. I'm so sorry if I butchered your name. Kim Armbrust. You are our second winner of 20 units of Botox.
I think I just saw Kim on the comment list. Kim was there. So congratulations, Kim.
And our last winner is Janelle Pugliese. You are our winner for 20 units. Congratulations to Michelle and Janelle and Kim. We will certainly put those on your account. We'll be calling you to let you know in case you didn't tune in towards the end, just to let you know that you won. Thank you guys so much for watching, and
thank you so much. I will be seeing you, and can't wait to have our injections done and have the good result.
Have a great night, everybody. Bye.
Bye. Good night, everyone. Thank you.